Good morning. Welcome to the Diamond Jubilee Maternity Unit at the Lister Hospital in Stevenage. My name is Kelly McNamee and I'm one of the consultant obstetricians who perform elective caesarean sections. The purpose of this video is to walk you through the journey of an elective caesarean section. It may be beneficial to see parts of the hospital you've never seen before, prompt any questions you may have, and give you more information to help you and your birthing partner feel less apprehensive on the day. You will be sent a letter confirming the date for your caesarean section, and you will be asked to come to hospital either 7:30 a.m. or midday, depending if you are on the morning or afternoon operating list. Please remove any makeup and nail varnish prior to attending the hospital, and remove all jewellery where possible and leave it at home. Your birth partner can accompany you provided they have no COVID-19 symptoms and they have had a negative rapid lateral flow test within the 24 hours prior to your admission. You will be asked to attend Dacre ward on the first floor. Welcome to Dacre ward. This is the bay where you'll meet the midwife looking after you and your baby during the caesarean section. You will also meet some of the theatre team, including the scrub nurse, anaesthetist and the obstetrician who is operating that day. You'll be given a gown and sub-head stockings to reduce the chances of blood clots in the legs. The midwife will perform a thorough assessment of you and your baby, including blood pressure, pulse and fetal heartbeat. All your paperwork will be checked for details such as allergies and medications. Some questions may be repeated by team members, but it's purely for safety. The anaesthetist will ask some questions relating to your medical history and the anaesthetic procedure. The obstetrician will confirm your consent for the procedure, but also ask about specific personal choices for the birth of your baby. These will include dropping the drape so you and your birth partner can see the baby for the first time together, delayed cord clamping, and skin to skin. It is also a great opportunity for you to ask any specific questions. There can be between 1 and 5 caesarean sections on a particular operating list. Once everyone has been reviewed, you will be given an estimated operating order number for your caesarean section. Due to unexpected events, this time can be delayed or even cancelled on the planned day of surgery. However, we will do our utmost to keep you informed. We will now go down to CLU where your caesarean section will take place. This is the waiting area where we will check you into theatre. Your nominated birth partner will join you and they will be given some surgical scrubs to change into. You will have your belongings with you, including a nappy and hat for baby, in addition to the ever important camera. Please take any valuables you have with you into theatre, as the trust can't accept responsibility if anything is lost or stolen. One of the theatre team will go through your details once again as part of our mandatory safety check. Once the anaesthetist is satisfied with your anaesthetic, we will insert a catheter into your bladder and put up a drape. We will clean your tummy with a cold antiseptic wash. You can feel this, but you will not feel pain. The anaesthetist will be talking to you and can keep you informed of how the operation is going. As discussed earlier, we can drop the drapes for you and your birth partner to see the baby together. You will not be able to see the surgical area, which understandably can be a little off-putting for some people. Following this, your midwife will dry the baby and support skin to skin for you and your baby if you wish. It is not uncommon for babies to be a little surprised at a caesarean section, and therefore it can take a few moments for your baby to cry. The caesarean section should take approximately a further 40 minutes to complete from this point. While the obstetricians finish the last details of the operation, your baby and birth partner will go to the recovery area. You will closely follow behind once we have transferred you to a more comfortable bed. Now we will show you the recovery area. This is the area where we will monitor you and your baby for approximately 2 hours. All your observations will be recorded, such as blood pressure, pulse and urine output. Additional pain relief will be prescribed as your anaesthetic will slowly wear off. You will receive support in holding and feeding your baby. Finally, your stay with us will end in the postnatal ward, which is where we will head to now. Your birth partner cannot accompany you to the postnatal ward at this time due to the ongoing COVID-19 visiting restrictions. However, once you have been allocated a bed space, you will be able to book a visiting slot for the same named birth partner the following day. Gloucester ward is where you will continue your recovery. Midwifery staff will perform routine health checks on you and your baby. We do encourage you to move and to start eating, as this results in a quicker recovery time and fewer post-operative complications. Your catheter is also removed once you can walk. As long as there are no complications and your baby is feeding, it is not uncommon for you to be able to go home the day after your caesarean section. You may need to be reviewed by an obstetric doctor prior to discharge planning. You will be followed up by your community midwife to guide you with additional advice with regards to recovery from your caesarean section. Speaking on behalf of all the maternity staff at the Diamond Jubilee, we want to make the birth of your baby as special and as safe as we can, and feel privileged to be part of your pregnancy journey.